Okay, so good day everyone. How are you to find out? Sure. So today we're going to discuss about botulism. So we're going to talk about the overview of botulism, the etiology, the mode of transmission, the risk factors, the pathogenesis, the clinical manifestations, the complications, the types of botulism, the laboratory and diagnostic procedures, the medical management, the nursing diagnosis, and the prognosis. Okay, so um, so botulism comes from the Latin word botulus, which means sausage. Fact, canned sausage was the first food product where botulism was found. So botulism is a neuroparalytic condition caused by the bacterium Clostridium botulinum. It releases a neurotoxin, which is a poison that attacks the nervous system. So the toxin acts by interrupting signal transmission in the somatic, which controls the voluntary muscles, and autonomic motor systems, which controls the involuntary muscles like heartbeat and breathing, without affecting the sensory signals or the mental function. So, botulism is a worldwide and widespread. So there are 8 strains of Clostridium botulinum from A to H, and they all produce a different toxin. But only strains A, B, E, and F causes disease in humans, and some of these strains cause disease in mammals. So, of the many types of foodborne illnesses, botulism is one of the most dangerous. It causes paralysis and it can be life-threatening, but it is rather rare. Okay, so let's move on to the etiology. So, it is caused by the bacteria Clostridium botulinum. It is a gram-positive bacilli and it is rod-shaped. It is obligate anaerobe, which means that it requires no oxygen for it to grow. It is motile and spore-forming. So the mode of transmission, how how we actually get botulism, of course, via the different routes. So first is through ingestion of contaminated food that oftentimes was improperly or inadequately stored. For example, a homemade canned food. So, for example, homemade canned food that was not properly pressurized and heated will actually uh, for heated to destroy the bacteria. So, and also it is very difficult to identify if the food has the Clostridium botulinum because they don't smell and has no taste. Second is through inhalation. So it occurs in laboratory settings, but it is rarely occurs. So the third one is direct inoculation. So this type is essentially there is a puncture wound where the spores of the bacteria can enter into it. And again, it rarely occurs. So that is that's the mode of transmission of the botulism. So now let's move to the risk factors. So these are the people who inject certain drugs, which increases their risk for wound botulism. And people who eat home canned or home fermented foods that haven't prepared safely also have a greater chance of becoming seriously sick. And also people who get botulinum toxin injections for cosmetic reasons such as Botox. But let's dig into that later. So the pathogenesis of botulism is when toxin enters the bloodstream from ingestion, mucosal surface or wound, it binds to peripheral cholinergic nerve endings. And the neurotoxin that was released by the bacteria will then blocks the motor nerve endings. Then it will inhibit the release of the acetylcholine, preventing muscles from contracting, causing symmetrical descending paralysis starting from the cranial nerves and progresses downwards. It can result from airway obstruction or paralysis of the respiratory muscles. So normally, what happens in an individual is that in the presynaptic neuron, this is where the acetylcholine is stored. And what happens that in the skeletal muscles, we there is also what we call as the acetylcholine receptors, and the presynaptic neuron will release the acetylcholine into the synapse, and it will then bind to the acetylcholine receptors that is found in the skeletal muscles, leading to the contraction of the skeletal muscles. So when there is a botulism present, this toxin can actually bind to the presynaptic neuron, thus preventing the release of acetylcholine into the synapse. So there is no activation of acetylcholine receptors in the skeletal muscles. That's why we lose our ability to contract our muscles. So what happens is that when the spores of Clostridium botulinum will form under certain conditions, again, as I've said, Clostridium botulinum requires no oxygen at all. It needs an environment that has no oxygen. So if there is something that causes stress to the bacteria, like for example, presence of oxygen, the bacteria will sense it and will produce spores to protect itself. So these spores are metabolically inert and resistant to many environmental stresses. So the when these spores enter the environment where it is conducive for the growth of the bacteria, those spores will actually revert back into Clostridium botulinum, and this Clostridium botulinum itself is what produces the neurotoxin and releases it to the surrounding environment. And this toxin is actually one of the most dangerous toxin discovered. So the environment conducive to spore formation include low oxygen. So we all know that bacteria needs no oxygen to live. Another is temperature between 25 to 30 degrees Celsius, for example, a room temperature. So third is acidic water with pH greater than 4.6. Now, let's move on the clinical manifestation of botulism. So, botulism infections have a varied symptomatology, from mild symptoms to severe and life-threatening symptoms. So, all three types of botulism have characteristics in common is that they all have symmetric descending paralysis, which means it affects both sides of the body and starts from the head and goes down toward the toes. So second characteristics is that there is no fever in botulism infections. The third is that they may have visual disturbances, but there are no other sensory deficits. Fourth is that although they may have descending paralysis, they are actually alert and responsive and they know what's going on. Let's move on to the types of botulism. So first is infant botulism, also known as floppy baby syndrome. So floppy baby syndrome means no muscle tone, and it is related with the characteristic finding of descending paralysis. So this is the most common type of botulism, and it affects infant of 1 week to 12 months of age. So this is because most of the time it affects the infants under the age of 6 months. It is because due to their immature gut flora. So in an infant, since they have an immature gut flora, if they consume foods with Clostridium botulinum, so when those spores can enter into their intestinal mucosa, it can then flourish, and multiply in intestinal mucosa and produce toxins A, B, E, and F, which are responsible for infant botulism. So there are some evidences that support that infant botulism is classically associated with eating honey, uh, especially under the age of 1 year old. Uh, so the symptoms of infant botulism include constipation, anorexia, poor feeding, and then we can notice some of that loss of muscle tone, which is manifested by loss of head control and can be an initial symptoms of infant botulism. You can also see drooling, and the baby can also have a weak cry and a drooping eyelids. So the next type of botulism is foodborne botulism. So the next, and it's as its name suggests, from consuming food that contains toxin. So after ingestion of the toxin from the food, the incubation period is approximately 10 to 36 hours and can be prolonged, and it may take up to 2 weeks. So it is caused by the toxins A, B, and E, and again, it is due to the consumption of contaminated food. So the prodromal symptoms are, or the early symptoms of foodborne botulism includes nausea, vomiting, diarrhea, or constipation. You will also notice dry mouth, sore throat with this condition. Okay, so the symptoms of foodborne botulism includes vertigo, dry eyes, and blurred vision due to the effects of toxin on the cranial nerves. We can also see ptosis with dilated pupils. Other symptoms include dysphagia or difficulty swallowing. Then paralysis can begin to descend, causing flaccid paralysis. And if the process reaches the respiratory muscles or the diaphragm, which is responsible for respiration, it can be fatal. So the next type of botulism is wound botulism. So wound botulism is similar to other types of botulism, except it has a prolonged incubation period and is usually about 10 days. What happens here is that when spores enter into an open wound or puncture, but it rarely occurs. So wound botulism is similar to foodborne botulism, except that there are no prodromal or early signs of GI symptoms like nausea, vomiting, diarrhea, and constipation. So in wound botulism, you may have fever or leukocytosis, but as I've said earlier that one of the characteristic findings of botulism has no fever, but rather it is caused by the secondary infection from another type of bacteria entering to the open wound, causing the fever and infection. So symptoms of wound botulism is very similar to foodborne botulism, such as vertigo, dry eyes, blurry vision, descending paralysis. Okay, so let's move on to the complications. So the complications of botulism is that because it affects muscle control throughout your body, botulinum toxin can cause many complications. The most immediate danger is that you won't be able to breathe, which is the most common cause of death in botulisms. Uh, Other complications which may require rehabilitation may include difficulty speaking, trouble swallowing, long-lasting weakness, shortness of breath. Okay, so next, laboratory and diagnostic procedures. So the diagnosis of botulism is to detect the toxin through looking at their serum and checking their blood, and we also have checking their gastric contents or stool to see if there is toxin present. So another diagnostic procedure is electromyography, which is a nerve and a muscle function test. And another is brain scan to help rule out other symptoms such as stroke. And lastly, spinal fluid exam may show slight increased level of protein. So we have here the blood and stool culture. We have the electromyography, brain scan, and the spinal fluid exam. So next is the medical management. So intensive care immediately. We have ventilator for respiratory failure. And another treatment is gastric lavage if performed within hours of ingestion. So this is where fluid is poured down the stomach and then suck it back up within hours after ingesting the food that contains the botulinum toxin. So it is really important to determine if the food that was consumed has the toxin before performing the procedure. So uh, let's talk about botulinum, the Botox. So many of us are familiar with Botox. So actually, it is a botulinum toxin A. So actually, what scientists do is that they cultivate botulinum and the spores to produce this type of toxin, which is widely used for cosmetic use. They inject the botulinum toxin A to cause facial muscle paralysis and to reduce or get rid of wrinkles. So this can also be indicated for conditions such as neck spasm or cervical dystonia. So the prevention, botulinum prevention is that uh, Clostridium botulinum toxin can be inactivated with high temperature, at least 120 degrees Celsius for at least 5 to 10 minutes. So it is very important to cook food properly. Another is avoid feeding honey or corn syrup to children under 1 year of age. As I've said earlier, that there is some evidence that honey is associated with infant botulism. And another is be very careful preparing or eating any homemade canned foods and avoid eating contents of the canned food is if the can is bulging because air suggests the presence of Clostridium botulinum. So the nursing diagnosis is impaired physical mobility related to neuromuscular impairment as evidenced by limited range of motion. So nursing interventions include obtain a careful history of food intake, assess the strength to perform range of motions, monitor the intake and output, observe the patient for abnormal neurologic signs, position the patient in proper alignment and assist with range of motion exercises, encourage deep breathing and coughing exercises, administer IV fluids as ordered, administer oxygen as ordered, and administer medication as indicated. So another nursing diagnosis is an effective breathing pattern related to descending paralysis as evidenced by altered breathing patterns. So nursing interventions include assess the frequency, symmetry, and depth of breathing, observe for signs of respiratory failure, assess oxygen saturation, and review the client's arterial blood causes results. So keep the head elevated and anticipate the need for mechanical ventilation, administer medication as ordered. So the prognosis of botulism is that the type A disease is more severe than type B or E. So the mortality rate from botulism is higher among patients older than 60 years as compared to younger patients. So more foodborne botulism mortality is 25% except for patients younger than 20 years who have a mortality rate near 10%. Wound botulism, so the mortality rate varies from 15 to 17%. In infant botulism, the mortality rate usually is less than 1%. So mortality is due to the following. We have delayed diagnosis, respiratory failure, and hospital complications such as nosocomial infections and is usually related to pneumonia. So that's it, and thank you for watching.